Hey, if you have knee pain, I'm going to take you step by step on how to strengthen and stabilize and mobilize your knee joints. So first of all, there are different diagnoses of knee pain. You have the patellofemoral joint, which is actually right where the kneecap is, adjoining to the tibia and femur. And then you have tibiofemoral joint, which is literally between the tibia bone and the femur bone. So it's actually where that main knee joint, the hinge joint, is. The patellofemoral joint is different. So it's in the front, and it's very common to have something called chondromalacia or patellofemoral syndrome. The back of your kneecap starts to break down where you end up getting a rough surface. So you'll know if you have chondromalacia or patellofemoral syndrome if you place your hands on your knee and you just straighten and bend and you can hear it crunching. There's a lot of crunching happening behind the kneecap. So mine does crunch, but it doesn't hurt. I have no pain. I just kind of hear a little crackling and then a little pop here and there. But if you do have pain and it has not gone away and it's constant, then some people, especially when they're active or they're athletic, they opt to get an arthroscopic decompression surgery where the orthopedic doctor goes behind the kneecap, scrapes out any bone spurs or the irregular surface to make it smooth. And it's very minimally invasive, but it really does help to get rid of that crunching sensation. Basically, those bone spurs or the irregular surface is scraped out. So that's for chondromalacia and patellofemoral syndrome. Now, why would somebody get patellofemoral syndrome or chondromalacia? It's usually because there's a postural imbalance. So in females specifically, if I stand and my feet are together, well, you'll see that my knees barely touch. So I have something called bow-leggedness or Genu. Sometimes people stand and their knees touch and their feet are apart, and that's called Genu valgus or being knock-kneed. So if you have a little bit of strain on your knees because the tibia is either varus or valgus, then that can put strain through your kneecap as well as your knee joint. The best way to try to manage that kind of knee misalignment, if you will, is to strengthen the muscles surrounding your entire knee joint. So that would be the front is your quadriceps. The inside would be the adductor muscles or inner thigh muscles, along with the VMO or Vastus, Medialis, Oblique, which is part of your quad. And then you want to strengthen the outer thigh, outer knee, which would be the Vastus lateralis, and then the posterior knee or the back of the knee, which would be the hamstrings and the calves. So when you strengthen your knee, you can end up taking some pressure off of the strain through the meniscus or through the kneecap. Another thing is foot mechanics. If you're standing and your feet roll in, this is called overpronation syndrome. So the inside of my feet, the arches would be fallen and then my feet roll in, my pinky toes kind of go up. From the back view, your heels also roll out. That's called calcaneal eversion. So for overpronation problem, you want to strengthen the muscles in the bottom of your feet. They're called the intrinsic muscles. And or use orthotics to give yourself some additional arch support, especially if you are a walker or a runner, or you play sports like soccer or lacrosse and you're wearing cleats. You want to put arch support under so your feet don't position like this, which definitely puts a lot of strain in the knees, hips, and spine. So once you put the arch support in, it's going to give your foot more of a neutral positioning. Now you could be an oversupinator where your feet are like this and you're balancing on the outsides of your feet. So in that position, you would have to get orthotics that may give some support on the outer part. It's called posting, or find shoes that are called neutral shoes. And they will actually almost naturally allow your feet to kind of fall in. So it just depends on the severity of how much your feet are overpronating or oversupinating. If it's just kind of a general overpronation, a lot of people can get away with just over-the-counter orthotics like Superfeet or the Dr. Scholl's, or there's many other brands out there. I don't know which ones are the best ones at this point. But if you have pretty severe overpronation or pretty severe supination, you may have had a lot of ankle sprains, which caused your ankle bones, the ligaments, to be loose. Then you might have to get customized orthotics, in which you would see a physical therapist, a podiatrist, or a certified orthotist, prosthetist. So they would cast your foot, figure out exactly where the asymmetries are, and then they would create custom orthotics for you. I've seen a lot of patients get custom orthotics when both of their feet have different asymmetries. So one side could be severely overpronated, another side could be mildly overpronated, and so on and so forth. So for patellofemoral strengthening, what I want to do is take you through a series of exercises that are going to help you strengthen your quadricep. The first one is called a quad set. So as your legs are out in front of you, you can rest your hands down. What you want to do is press the back of your knee down into the mat. Press down, and what that does is it contracts the quadricep muscles. You'll feel a little compression in the kneecap, but if you cannot straighten your knees fully, and then you start doing things like straight leg raises, you're going to end up having a lag of knee flexion, and that actually weakens your quads over time. You want to make sure that you are able to achieve quad set, straight leg raise with the quad set. So that exercise you can just practice by pressing down and release. 5-second hold down and then release. Then for straight leg raise, you can bend your opposite knee, flex your foot, engage your core, and then lift your leg up and down, which I typically like to teach a straight leg raise lying down. So you would be here where your hip angle is straight. Brace your core, tuck, flex, and then lift your leg up and down to the height of your opposite knee. So this will help strengthen the front thigh and the front hip. Straight leg raise with a quad set, also known as terminal knee extension. So your knees stay straight the whole time. You'll know your quad is shutting off if your knee starts to bend and your leg is lagging. So now the distal part of my quad down here, distal versus proximal, the distal part is not activating as well. You really want to try to get that active the whole time. And then after you can complete 3 sets of 10 on both sides and you're feeling work, but you want more challenge, that's when you would add resistance. This is 2.5 pounds, just a little cuff weight. You're going to put that around your ankle, and you can double it up, or some of the weights that are sold in the stores and on Amazon, you can actually put like 1/2 pound, 2 pounds, 3 pounds, up to 5 pounds on each one. Tuck the tailbone under, brace your core abdominals, flex your foot, lock your knee, or at least get that terminal knee extension, not hyperextension. And then again, you're going to lift up and lower down with control. 3 sets of 10. I can definitely feel a difference just with 2.5 pound change. And so I'm working on really isolating and concentrating on strengthening the front thigh, the front quadricep. Okay, so the same thing goes for strengthening the entire knee. You want to change position of your thigh. So we got front thigh or anterior. Now we're going to get the inner thigh. So I'm going to move this leg out of the way. It can come in the front or behind. And then same thing, you want to do terminal knee extension or straight knee. Brace your core and then lift your leg up and down off of the mat into hip adduction. And this will strengthen the inner thigh and VMO, vastus medialis oblique muscle. And that gets the inside or the medial side of your knee. Once again, you're going to do 3 sets of 10. You should feel some fatigue and a little bit of muscle burning, and then master that, and then you can change the resistance with either more or less weight. 3 sets of 10 for hip adduction. Now, this is strengthening your knee, but it's also really strengthening your hip joint. And then for the posterior knee, same thing. You're going to tuck your tailbone under, brace your core, lock your knee, and lift up and down into hip extension so that you can get your hamstring. Now I'm going to point my toes just so I can get my foot out of the way. As I lift and lower, I don't want to bend my knee and let it lag. I'm trying to keep it super straight the whole time. And then also, hamstring curl while I'm here. It's going to be too easy though. So just doing a hamstring curl up and down, it's going to be pretty easy unless you've had like a knee replacement or you're just out of surgery for an ACL repair or something like that. But this hamstring curl, you can do it with a flexed or pointed foot. Now I'm strengthening the distal or the bottom part of my hamstring closer to my knee joint. But when my leg is straight, I'm strengthening more the proximal or the hip side of my hamstring. Okay, 3 sets of 10. And then last but not least, hip abduction. So you can bend the bottom knee for support. Top leg is straight. You want to engage your core abdominals so you don't tweak your back. Flex your foot and then lift your leg up and down parallel with the ground. And this will strengthen the vastus lateralis, the outer thigh. And then you can do this with resistance, without resistance, 3 sets of 10. I feel it more on my outer hip because my knee is straight. You could also do like a short lever hip abduction, but really the best way to strengthen your hip and knee on the lateral outer side is with a straight leg raise. Okay, so that's 3 sets of 10 also. Now, I want to tell you a little bit about open kinetic chain versus closed kinetic chain. So open kinetic chain, it means that you're not weight bearing. The distal segment, which I keep saying distal and proximal, but distal just means the end and proximal means up higher. So the distal segment in this case is my foot. And when I have a weight on my foot, then my distal segment is not weight bearing. It's not fixed. So it's called open kinetic chain. I'm able to actually move my foot freely. Closed kinetic chain, on the other hand, is where I'm weight bearing. So that would be whenever I'm doing squats or lunges. So now I'm weight bearing and I'm sitting back into a squat. This is closed kinetic chain. So I'm now weight bearing through the distal segment and I'm strengthening my quads that way. So the issue is, if you're suffering with knee pain and you start to notice that the knee pain increases with weight bearing, then squats and lunges are not going to be the most ideal way for you to strengthen your knee. Instead, open kinetic chain exercises will be the better choice. Not forever, but at least temporarily for the time being, until you build up the strength around your knee joint with open kinetic chain with the highest amount of resistance that you can tolerate. So I recommend open kinetic chain knee strengthening most of the time for people with knee pain. I don't tell them do more squats, do more lunges, run up and down the stairs. That actually tends to exacerbate the problem. So for open kinetic chain, you're going to be seated and then you're going to straighten your leg up and down into full terminal knee extension. This helps to isolate your distal quadricep now. This is really, really, really targeting your knee joint. So this weight is only 2.5 pounds. It's not a whole lot of resistance. When I've experienced knee pain and I'm trying to rehabilitate or recover, I go to the gym and I hop on one of those machines that allows me to do, like I'll lean back in the chair and then I'll straighten both of my legs out against resistance. There's like a padding across my shins or my ankles, but there's one at my gym where you can do it separately, one leg at a time. So then I can just adjust the weight to 20, 30, 40, 50, 60 pounds individually. And then I place that padding in front of my shin. And then I just straighten the leg up and down. And I can feel my quadricep burning and just really getting that challenge of strength. And I do 3 sets of 10 or 3 sets of 12, as long as I don't feel a lot of pressure in my kneecap. And that helps to strengthen your quadriceps very effectively so that you can start getting your knee pain under control. Once your knee can tolerate open kinetic chain strengthening, then I introduce closed kinetic chain strengthening, which would be squats and lunges. So with closed kinetic strengthening, you would open your feet about hip width apart, engage your core abdominals, sit back into an imaginary chair, not letting your knees go past the toes. Not that it's terrible for your knees to go past your toes, but when you're doing a squat, the more you shift forward, so I'm lifting my chest and I'm shifting my knees forward, the more compression and force production happens in the kneecaps. So instead, you want to shift your butt back so your knees are more behind your toes, and then press up by pushing your feet into the ground and then rise up all the way. Sit back, press your feet down into the ground to rise up. So this one you're going to do 2 sets of 10. And again, this is closed kinetic chain. This is more of an advanced strengthening technique for your knee joints. If you start to feel pain in your kneecaps or you feel some instability, then there's a couple of things you can do to make that pain lessen. You would actually place a ball or a yoga block between your knees. So something like this is a little squishy Pilates ball. So you could squeeze it, plant your feet down, sit back, squat. So now I'm engaging my adductors or my inner thigh muscles as I'm working on my squats. And again, this is strengthening the quadriceps. As I press up, it strengthens my glutes and my hamstrings. But you don't want to feel compression and pain through your kneecaps or your knee joints. If you do, it's not the appropriate exercise for you. Another option is to place a band around your thighs. And now I'm pressing my legs out so I can get my abductor, outer hips, in control as I squat, sit back, and press back up. As I squat, sit back, I'm actually pushing my knees apart and I'm grounding my feet down into the mat. Sit back, pressing your knees apart, press your legs right back up. So if you do this 2 sets of 10, you're going to concentrate on activating quad control and creating symmetry. Now remember what I said about overpronation? If you're wearing shoes, your feet are going like this. Every time you squat down, your knees start to come together. That's contributing to uneven forces into your kneecaps. So you have to have your feet grounded, big toe, pinky toe, and the backs of your heels. As you press the knees out, you're trying to maintain this straight alignment. So now for lunges, I'm going to place my feet parallel on the mat, hands to hips, engage my core, sit back, knees stay behind the toes, step back with one foot, lift the trunk torso upright, and then I'm trying to stretch the mat between my 2 feet. This knee in the front should not be translating towards the toes. It ideally should be perpendicular with the mat. And then you're going to dip down and press up, dip down, and press up. 2 sets of 10, making sure that your knee does not translate towards the toes or past them. And so as I'm moving up and down, I'm also tractioning my feet apart. That makes me kick on my glutes and hamstrings and my quadriceps way more to create stability. And then step forward, switch sides, step back, dip down, keep your knee behind the toes. Same thing. I'm pressing my feet apart, activating my glutes, hamstrings in the back, and my quadriceps in the front far more. If you start to feel a sharp pain or sensation of pretty obvious discomfort, then you should not do these lunges until you're able to achieve it without pain. I would go back to more open kinetic chain strengthening for your knees. Okay, and then release, kind of shake that out.